Hi everyone, I'm Mark Benjan Abes from BSN3A of NAST, and for today's video, I will demonstrate nasogastric tube insertion. And if you would like to see what this video is all about, please keep on watching. What is nasogastric tube? A nasogastric tube is a special tube that carries food and medicine to the stomach through the nose. Purposes: to administer tube feedings and medications to client unable to eat by mouth or swallow a sufficient diet without aspirating food or fluids into the lungs. To establish a means for suctioning stomach contents to prevent gastric distension, nausea, and vomiting. To remove stomach content for laboratory analysis. To lavage or wash the stomach in case of poisoning or overdose of medication. Assessment: check for doctor's order. Rationale: check appropriate orders relevant to patient safety, and this should be commensurate with the reason for the NG tube. Client's level of consciousness and level of knowledge and understanding. Rationale: patient must be able to follow instructions related to NG insertions to allow for passage of tube through nasal and gastrointestinal tracts. Availability and functionality of the needed materials. Rationale: this is to make sure that the equipment is functioning properly before using it on the client. Check for history of nasal surgery or deviated septum. Assess patency of nares or nares. Rationale: check for history of nasal surgery. It means that there could be a thinning of the wall nasal membrane. Assess for the best rostral before you begin. There might be a problem with the continuous passage of the airway of the patient. Determine presence of gag reflex. Rationale: a gag reflex is a defense mechanism of the body to prevent aspiration. Assess mental status or ability to participate in the procedure. Rationale: patient must be able to follow instructions related to NG insertions to allow for passage of tube through nasal and gastrointestinal tracts. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. Because nasogastric tube has different sizes and is intended for different ages. Prepare equipments: large or small bore tube, non-latex preferred, non-allergenic adhesive tape, 2.5 cm or 1 inch wide, clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw, 20 to 50 ml syringe with an adapter, basin, pH test strip or repeater, bilirubin lipstick, stethoscope, disposable pad or towel, clamp or plug, anti-reflux bulb for air vent if silent sump tube is used, suction apparatus, safety pins and elastic band, CO2 detector. Implementation: introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do. Morning, ma'am.
Morning.
Good day, ma'am. I'm Mark Benjan Abes from NAST and I will be your student nurse for today. May I know, ma'am, what's your name
Ana Maria Lilio,
and your date of birth?
June 14, 2001.
Okay, ma'am. So, ma'am, for today, I will be inserting an NG tube, which is a soft tube that goes in through the nose, down the throat, and into the stomach. And it will provide you all the nutrients and medicines that you need. But I want to make sure that you're aware that it will activate your gag reflex while inserting. That's why you will feel a little bit of unpleasant. That's why you can cooperate by letting me know if you're in distress by raising your hands, so I can pause the insertion and let you take a rest Take a few breaths and take sips of water to calm the gag reflex. Okay, ma'am?
Okay.
Assist the client to a high fallower's position if his or her health conditions permits, and support the head on a pillow. Rationale, it is often easier to swallow in this position, and gravity helps the passage of the tube. Ma'am, I'm gonna assist you to the upper position. Okay, ma'am?
Okay.
Ma'am, are you comfortable?
Yes.
Okay, ma'am. Place a towel or disposable pad across the chest. Rationale, nasal and oral secretions may be evident during the procedure. Ma'am, I'm gonna place the towel in your chest.
Okay.
Perform hand hygiene and observe appropriate infection control procedures. Rationale, this prevents the transmission of microorganisms. Ma'am, I'll just perform hand hygiene before we start the procedure.
Okay.
Provide for client's privacy. Ma'am, I'll just close the door for your privacy.
Okay.
Assess the client's nares or nares. Rationale, check for history of nasal surgery. It means that there could be a thinning of the wall nasal membrane. Ma'am, I'm gonna check your nares, okay?
Okay.
Okay, ma'am. Assess for the best nose treat before you begin. There might be a problem with the continuous passage of the airway of the patient. Ma'am, can you put your finger in one of your nostril and then blow?
Okay.
Ma'am, can you do it in the other side?
Okay.
Okay, ma'am. Prepare the tube. Ma'am, I'm gonna prepare the tube before we start, okay?
Okay.
Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Rationale: this determines the appropriate length of the NG tube to be inserted. The distance varies among individuals. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Rationale: a water-soluble lubricant dissolves if the tube accidentally enters the lungs. Never use non-water-soluble lubricants, example, Vaseline, as it will not dissolve and may cause respiratory complications if it enters the lungs. Insert the tube with its natural curve towards the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. Rationale: this follows the natural anatomical alignment of the nasopharynx. Hyperextension of the neck reduces the curvature of the nasopharyngeal junction. Ma'am, I'm gonna start. Before that, here's a cup of water, and if you feel any discomfort, please raise your hand and take a sip.
Okay.
If the client gags, stop passing the tube momentarily. Have the client rest. Take a few breaths and take sips of water to calm the gag reflex. Rationale: sipping water through a straw helps to initiate the swallowing reflex and facilitate passing of NG tube. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. Rationale: testing pH is one of the way to determine location of a feeding tube. Gastric contents are commonly pH 1 to 5, pH of 6 or greater would indicate the contents are from lower in the intestinal tract or in the respiratory tract. Confirmed by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Rationale, although still one of the methods used, do not use this method as the primary method for determining placement of the feeding tube. Secure the tube by taping it to the bridge of the nose. Rationale, taping in this manner prevents the tube from pressing against and irritating the edge of the nostril. Ma'am, I'll just secure the tube, okay?
Okay.
Ma'am, I'm gonna remove the towel, okay?
Okay.
Evaluation. Evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart. Ma'am, I'll just secure the tube into your gun, okay?
Okay.
Okay, ma'am, we're done.
Okay.
See you. Thank you.
Okay, thank you.
And that is it for this video. I hope you enjoy watching and learned a lot. I'll see you in my next one. Bye!